getting older now, but the kind of service Qazi Saab has done to the city in terms of charity, in terms of compassion, in terms of helping the poor, is really a model. And after he finished from, he's US educated in the 60s, came back and he served this city and then continued to do so with fantastic programs. One of them is Pray and Pray Pain Relief and You. We'll talk about that, and thank you for coming, Qazi Sahab, and he's been a really amazing figure for us. And respected Janab Nasir Ahmed Sahab, who is a member of the Legislative Council and also a secretary to the Chief Minister, private secretary, I don't know what he's called, but he is initiating major changes in government policy and everything. And he's been a supporter of these kind of mercy movements all through. And my dear respected colleagues, doctors, NGOs, social workers, and everybody. Pain Relief and You is a fantastic program. Like I said, Qazi Saab, Feroz Abdullah Feroz. Show up here. Everybody knows you, but then please give him a big hand. Okay. Hopkins ke Shankar Sahab. Hopkins ke Shankar Sahab.
Wonderful doctors who are here. That's more important than me.
Yeah, I think some very, very senior doctors are here with us today, and I don't want to talk too much, but then Bangalore is a blessed city. Karnataka is a blessed town, Bangalore is a blessed city. Because of the ethos on which this society stands, there is a certain amount of fraternity here, a certain amount of egalitarian values that this society embodies. Any society, we talk of health and healthcare, but we also need to speak about the health of a society. Society की भी health होती है, इंसान की जैसा health होती है, society की भी health होती है. And the health of a society has several parameters on how the health of a society is assessed. But one of the parameters for the health of a society is how the lowest of the low, the poorest of the poor, the weakest of the weak, the minority of the minority is well taken care of by the elite, by the well-educated, by the country. If we take care of that child in the womb of the mother, we take care of that poor patient who cannot afford cancer care and orthopedic care and dialysis care and so many hazard diseases. Friends, God's blessed us. As doctors, we didn't buy the brain that came to us. Correct, sir? ಈ ತಲೆ ಇಷ್ಟೆಲ್ಲ ನಮಗೆ ಎಕ್ಸಾಮ್ ಪಾಸ್ ಮಾಡಿ ಏನೋ ಮಾಡಿ ಇಲ್ಲಿ ಬಂದಿದ್ದೀವಿ, ಇದು ದೇವರು ಕೊಟ್ಟಿರೋದು ಸರ್, ಇದು ನಮ್ದಲ್ಲ. ಎಷ್ಟಿಗೆ ಕೊಂಡ್ಕೊಂಡ್ರಿ ಸರ್ ಕಣ್ಣು? ಎಷ್ಟಿಗೆ ಕೊಂಡ್ಕೊಂಡ್ರಿ? ದೇವರು ಕೊಟ್ಟಿರೋದು ಇದು. And it is our turn to recognize that bounty of our Creator and do something in return to those people who are not endowed. ಅವ್ರಿಗೆ ತಲೆ ಇಲ್ಲ, ಅವರು ಹುಚ್ಚರು, ಅವರು ಎಜುಕೇಟೆಡ್ ಇಲ್ಲ, ಅವರು ಇಲ್ಲಿಟ್ರೇಟ್ಸು, ಅವ್ರಿಗೆ ಏನೂ ಇಲ್ಲ. ಬಟ್ ಅದು ಯಾಕೆ ಇಲ್ಲ, ನಿಮ್ಗತೆ ಯಾಕಿದೆ, ಅವ್ರಿಗೆ ಯಾಕಿಲ್ಲ? ದೇವ್ರು ಆ ಥರ ಮಾಡಿರೋದು. ನಾವು ಯಾವ ಥರ ಬಿಹೇವ್ ಮಾಡ್ತೀವಿ ಇದೆಲ್ಲ ತಗೊಂಡು ಅವ್ರು ಯಾವ ಥರ ಬಿಹೇವ್ ಮಾಡ್ತೀವಿ. Gift of the gap and the gift of explanations and giving you all charts and data. Countries 5%, 8%, 9% ಆಗ್ತಾರೆ, ನಾವು ಯಾಕೆ 2% ಆಗ್ತೀವಿ? This is we are confused when it comes to healthcare, and really we should go to the slums, we should go to the tribal areas. Orissa ಹೋಗಿದೆ. You know what the infant under 5-year child mortality in Orissa in the hill areas is? 20% of all children die before the age of 5 years. And the primary killer is, we need to realize our country needs to go forward. Of course, Bangalore, Karnataka is very good. ನಮ್ಮದು ಬೆಂಗಳೂರಲ್ಲಿ ನಮ್ಮದು ಕರ್ನಾಟಕದಲ್ಲಿ SAST ಅಂತ ಇದೆ, Suraksha Arogya Trust. I'm an executive member there. It is rated the best in the country for several years. However it is, of course, there are good and bad things, but it is the best administered
Okay, no issue.
healthcare agency in the nation.
I'm in a meeting.
But
You can declare.
there is a national rating agency. For the last few years, Nasir sir, for the last few years, Karnataka is rated number 4 and number 5, not number 1. Yetedina number 1 birthday. And the single reason for that, and this is amazing, is because of the state government's handling of dialysis. Other states have gone far ahead and we have stayed back. And they are BJP states. ಸ್ವಲ್ಪ ಕಾಂಗ್ರೆಸ್ ಅವ್ರಿಗೆ ಹೇಳಬೇಕು ನಾವು. BJP states, the National Prime Minister Dialysis Program is extremely good. They have amazing concepts that they have come up with. Our state is lagging behind, dragging its feet. It's doubling its capacity. The Congress government has doubled the capacity, 100% increase. That is amazing. But 100% increase ಮಾಡಿದ್ರೆ 10% ಗೆ ಸೇವೆ ಮಾಡಕ್ಕೆ ಆಗ್ತಿಲ್ಲ. So we need to evolve, doctors need to give suggestions, and we need to make this better. There may be many other issues. Let's all discuss, let's give a feedback, and they are our people. They are people with a heart. They are people who want to serve. If we interact with them and give them those suggestions, they will make it. To use Mr. Trump's statements, let us make India great. Again, at the hell of that. So, thank you very much for this hearing and thanks for this function. Thank you. Thank you, everybody.
Very important subject we wanted to discuss today was healthcare, and I have a lot of doctors with us, but I know a few who have been doing a great work in the government sector. I know a few who are doing great work in the corporate sector, and each sector has a lot of contribution. I know Dr. Nadeem, I know Dr. Rehan here, who have done great work. I'm not able to take others, Dr. Yunus, I see some names. And why we...
Commissioner of GST.
Oh, okay. Oh, hello, sir. Hello, sir. Yes. Welcome. Just to, before we take the time of the Mr. Nazir sir on the contribution of healthcare in Karnataka, which he will give us a small rundown on. I was just Googling while I was in healthcare in India. So Indian healthcare is between two pyramids. Top of the pyramid is affordable and bottom of the pyramid is not affordable. So when we talk about healthcare, please keep in perspective that we are just not talking about Boring Hospital, Victoria Hospital. We are talking about 70% of the people who live in the rural area. We are talking about this, the objective of this program was to have a little wider dimension and interaction of doctors on this subject. So I now would like Nazir sir to present the government's perspective in the health delivery, and later on we'll have a short Q&A with him. People who know Nazir sir has been an entrepreneur. He comes from a government industry, and he was able to give employment to 18,000 people, as I know. So he was able to employ a huge amount of people in this industry. 4 times an MLC, 1 time an MLA. Passionate about social change. Thank you for being here, sir, with us today. Thanks a lot. And we invite you for a small presentation on healthcare.
Assalamu alaikum. It's a great pleasure to join this August gathering, and I'm extremely sorry that my
friend Dinesh Gundurao, Minister for Health and Family Welfare. He had agreed to participate in this function, but because of sudden his requirement in Sandur, which has a by-election, he has to go early morning at 6 o'clock. So he could not possibly be available here to have an interaction with all of you. But anyway, whatever little I know, the priority of the state government of Karnataka is education and health. The government is very keen about the health sector. And you could also see the number of medical colleges we have. And also, whenever we start a medical college, we require minimum 500 bedded hospital. So the idea of our Chief Minister is, in the name of medical college, we can provide a good health services to the people of that district. So that's how every district we have a super specialty hospital and we have a medical college. Thereby we could able to provide many of the health services to the people of those particular districts. Other than that, recently, I think about a week, 10 days back, the Chief Minister has launched a new program. It is called Graha Arogya. In sense, every house, the ASHA workers, they will visit, and particularly about 30 years, those patients, they will do blood test, they will do sugar test, they will do some hypertension, like that, some 6 parameters they have decided. They will individually go to the houses, do the survey, and whatever the treatment required, whatever the tablets required, every month they will be supplied with those tablets. The idea of the government is to stop going, this leads to many, if you have a blood pressure, sugar, that leads to a lot of other complications. The kidney problem, heart problem, all generates from these 2 parameters. So to stop this is the idea of the government, to provide the basic treatment at the early stage itself. So now this program is launched in Kolar. And Kolar, we have a very good infrastructure there, I think most of the doctors know about it. There is Tata Nerve Center is there in Kolar. So they have also undertaken a survey, house-to-house survey. So that infrastructure is available in Kolar, and that is the reason the government decided to launch this program in Kolar for the first time. So it is, and another very important program the government has come out is every taluk headquarters we have a dialysis center, every district headquarters we have a dialysis center. So other than that, the private NGOs who is running dialysis center, the government has decided to give 500 rupees per patient per dialysis, 500 rupees per patient per day. So this is also one of the new programs the government has launched quite recently. Other than that, most of the district hospitals have been provided with scanning machine, and you have all the facilities required for proper whatever you call scanning machine. MRI. All the district hospitals have been equipped with MRI. For your information, if I have to tell you, when we visited our hospital in Kolar, I belong to Kolar. So there was, people used to tell us that there is a very heavy rush. Even if we have to go and for a MRI, we have to wait for 2 days, 3 days like that. Then we went and inquired, and we got to know people from Bangalore go to Kolar to get the MRI done, because it is done free of cost. In a private hospital, they charge about 5,000, 6,000, 7,000, 8,000 rupees. So this is provided free of cost. In most of the district hospitals got MRI machines. Likewise, we also have a program called this anemia. That is really for the children's. They have tested nearly about 10 lakhs children so far from last 1.5 years. And they got some 1,76,000 children who got affected with anemia and have been treated. Likewise, there are many programs which I would like to tell you that if you go to the Health and Family Welfare site also, you will get to know about these programs. And the government is totally committed towards it. And we also, we wanted to make Bangalore as a health tourism. Health tourism, there also we are focusing more and possibly the new extensions wherever it is coming, we are looking for a health city. There is one program, very ambitious program of the government of Karnataka is Quick City that is coming near the Downstate. There we would like to have a health city. Health city will have all kinds of facilities. So these are all the many such programs are there, and I wish, and we are also giving a lot of importance for Ayush, Unani, Ayurvedic, all this also. Even now today, I don't know how many of you know, but we have nearly about 60 intake in our own Unani for the doctor. PMS intake is about 60 in Bangalore itself. So we have in Gulbarga, we have in, so like that, we are into health sector, the government is very much focused and government wanted to promote this health sector. And many of the multinational companies who are working with the health sector, they are also coming in a big way to support, and they wanted to come out with their own facilities because the environment of the city is such. Many of them wanted to have their super specialty hospitals in Bangalore. And also you can see a great number of people from abroad. They come here and they stay here and they get treated here, and they feel that this is the right place for their treatment. This is, I think by this time, most of you, the doctors, must be knowing that a great number of people, they come from abroad for the treatment. This is also, I think Dr. Matin also must be knowing about this. So I wish, the health minister should have been there, he would have been able to, particularly we have many programs like even for Asha Kirna, that program is there where every district we do this test for the eyes and provide the classes for them. All such programs are there, I think many such programs are there. And other than that, if any doctors are having any more information into it, whatever I could do, I will definitely able to contribute, or I can able to interact with you to whatever knowledge, information I have with me. Thank you.
Thank you, sir. So what we'll do is, as a part of the Q&A, we will basically, your questions, if Nazir Saab will answer. I've been briefed by the Health Minister on what things he has achieved, so I have some things on my WhatsApp, if I can answer you. And if there are some suggestions, we are going to note down these suggestions and give it to you, sir, so that you can hand it over to him, that what is the suggestions to be discussed on. Is that a better way? We can go on. Yes, so before we get into the Q&A, one of the initiatives of the Health Minister, which in 2023 June, which was an amazing thing which never happened anywhere in the country, was he identified that doctors need to be trained on management. And he spoke to the IIM Bangalore, and there is a program which is coming up. There is a healthcare professional program in IIM Bangalore which runs. He is now thinking about how to integrate these doctors to that PG program to develop the skills of management and administration. So that is one of the initiatives. I now would like you all to interact. Any questions, any clarifications, and suggestions. We will give the first priority to doctors. There are also some NGOs who are here who work very actively in the healthcare. They can also ask a question or suggestion. So yes, sir.
Hi, sir. I would like to know what is government's policy in giving basic health care for small clinic or doctor, to, does the government say that every village or every taluk should have one basic amenities for small ailments?
So I'll answer this question. There are primary health care centers which the government has already. In the last 1 year, please go up to the page of village hospital, and there is a 1 year progress report. It's publishing every month what is happening.
He referenced a lot of corporate hospitals.
I will tell you about the last 1 year. He has added 200 centers like this in the state. I'm just talking about additional. So there are already primary health care centers which are there. So it's a network. And like another 200 are added in the last 1 year.
You have to get closer to the mic. There's no mic. No mic.
Well, is it a government policy that every village must have a
Yes,
basic?
yes, yes.
So if it is not there, we can complete?
The policy is a central, it is a national health mission which drives the policy of health in the country. The state healthcare is a subject for implementation. We had Medical Council of India. Now, Medical Council of India was squashed 3 years ago. We have the National Health Mission, and that has drawn a beautiful policy across the country. State subject is implementation. The state takes that and implements that. Can add anything more also. Am I right, sir? Yeah. Any other questions? Answer your question. Yeah.
Government's policy, if patient goes to like the boarding hospital or something.
What is the government's policy? Is it government giving 100% free of cost to anybody who goes to the hospital?
Yes. So there are BPL cards. There is a BPL card which the government has. This is not only in Karnataka but pan India. If you're a BPL card holder, the treatment is completely free. There is no charges for a BPL card holder. Now, the Ayushman Bharat, which is the Prime Minister's initiative, above 70, you are completely free. That's completely free after 70. So there is a little grey area between the BPL and the affordable. That's a little grey area which has to be addressed.
Definitely, a lot of changes have happened in the health sector, starting from Yashaswini to SASD, and many patients are getting free surgeries and all. But definitely, I would say, rather than treat after the patient develops a disease, let us focus on the preventive aspect. Sir, Nazir sir, I would request, as you said, medical colleges are there, and now even PHCs are being upgraded. I would want reforestation to happen and naturopathy doctors to be present in every PHC, every urban health center, so that people can treat their health before they develop diseases. So naturopathy is a way of life. So people should understand, like Ayurveda, naturopathy is how we integrate with the nature and learn from nature how to live a healthy life. So that is very important because most of the hospitals, they have a Ayurvedic doctor who actually is prescribing allopathic medicines. So such sort of, at least let them practice allopathy in the private clinics, but let them practice Ayurveda and naturopathy in the government hospitals. And that integrated approach will be a less cost-effective thing. And what happens is, now I am a neurosurgeon, and now even for stroke, there are costly medicines which are something like, there are some medicines which are 50,000, and now newer drugs are coming at 2 lakhs, 3 lakhs. So it has become a money-making business, even for the government also, with a lot of commissions. So don't please fall into that trap, because you can treat the same patient with 150 rupees heparin injection with good outcomes. That I have been fighting in our own circles against the capitalism of medical industry. So what we need is a good integration, and one more thing for prevention of diseases is peaceful life for people. Because see, there are so many policies by the government which will create a lot of stress. So government should address to that, because I have seen a lot of complications with COVID injections like strokes, heart attacks, and even turbo cancers, wherein people are diagnosed with cancers within 4 months they're dying. So, Canada, Singapore, and even Japan, India should start giving compensation for COVID injection complications. And one more thing which I have been telling NIMHANS is to consider the supremacy psychosis as a disease, give it an ICD code and subcodes according to race, religion, caste, to treat the position and power or money, and treat the patients, treat the population. Psychiatric health is a big issue. There are children, recently one of our neurosurgeons, son committed suicide. So there are children who are dying of mental health problems. So mental health issues need to be addressed at a significant level, and pollution, pesticide, preservative, plastic, paint, and all these poisons of the society, that needs to be taken care. So please.
Yeah, we have noted down. In fact, we have a person noting down these suggestions. Sir, doctor, just can you give your name?
Dr. Bhanuprakash.
Yes, we have 1 or 2 questions left because people are feeling hungry. I don't know how to be. Yeah, please. Your name?
Assalamu alaikum. Good afternoon, everybody. Myself is Dr. Muhammad Umar Naz. I welcome you all. I welcome sir as well. And my few questions as well as suggestions is, few of the doctors here are who are running private clinics. They have a difficult challenge in getting KPMG certifications. So that needs to be streamlined, and we need to make sure each and every clinic at least in Bangalore, should have KPMG certified, so that we can stop the malpractices or spurious practices in medical science. Second is, there are only 2 medical waste management in Bangalore. One is for south and one is for north. And they are monopolizing the system, and that has to be changed. Third, due to the speed and our individual behavior, there is lot of difference in psychiatric, which as a mental health, especially at the school level, they need to take it up. Then I want to know what is the future plan if COVID-like situation comes. What is the government task force? Third, Bangalore has become an allergic rhinitis center because of your pollen grains and pollution. So till date, there is no answer to it, and people are suffering, especially October, November, December. Our ENT surgeons like Dr. South, he can explain better. We can take his suggestion. But not least, but not the last, that is, what is the government vision for 2030?
So I think so. Thanks, Dr. Akram, you said, right? What's your name? Dr. Umar, let me tell you 2 things. This is the only state which passed the resolution 6 months back for the nursing home height for fire NOC, which was 18 meters, it came to 21. No state in the country has done it. Why? Because it legitimized the small nursing homes to survive. That is the first thing which happened in this state. And
12 to 18.
yeah, I'll take that question. It is challenged. It is still not changed.
Actually destroying the old.
It is not changed. It will be challenged. It is amended. It is not changed. Second, the KPME process. Sir, people who know what I do, this is the easiest state in the country to get KPME. Easiest state. Believe me, easiest state. I am telling you with lot of authority. I am not a spokesperson of the Congress, nor the government. Okay? I am telling you out of my practical experience. Any other questions, sir? Yeah. And if it is repeated, we will not take it. We have not given any lady. All men have spoke. So there's a lady who was raised now.
But you want to know about heart attack?
Just one definitely.
Hi, please.
Thank you. In the interest of time, I'll just make it very short. I'm an ophthalmologist and I have just 2 concerns. I'm greedy about sight. So 2 things. for avoidable blindness. First is diabetic retinopathy. If you are a diabetic and if you are waiting that you have blurred vision before you go and meet an eye doctor, you're already late. So what is the government of Karnataka doing? That's my question number one. For early diagnosis of diabetic retinopathy. And my question number two is for children. We see that almost all children are into digital devices and pre-myopia has to be diagnosed. It's not enough that you diagnose a child that you have myopia and give glasses. Holistic environment should be there so that the myopia or short-sightedness does not progress. What is the government of Karnataka doing to ensure that there are enough parks and enough outdoor spaces and the curriculum of the school is changed so that there are compulsory, mandatory outdoor activities for children in any school curriculum? So these are my two questions, and my last thing is that this is a book which we have come out with, Understanding Myopia or Short-Sightedness. It is available freely on our website. And please, this is mainly for pediatrician, parents, educators and policymakers. So please see that you download and you understand that this short-sightedness is another new pandemic. And please be aware that it can cause vision-threatening conditions like retinal detachment, glaucoma, etc. Thank you so much.
Your name, we want your name.
I'm Dr. Samina Zamindar. I'm an ophthalmologist. Thank you.
You have got this book, we can, so Saib, can you take this? We'll give it to you to answering just one question of yours. If you look at point number 6 in the journey of Karnataka, the health minister has launched 8 district mobile vans in ophthalmology to do these tests. Just answering your question. 8 districts in Karnataka have been implemented with ophthalmology mobile vans. That's something I'm looking at.
Might be an officer in the health department.
Sir, sorry, we need last question, sir. We will take, and then we will wind up. We can meet one-to-one. Yeah.
Yeah. Good afternoon, everyone. I'm Dr. Girish Moore. I'm an interventional cardiologist who practices in the US, but I live here in Bangalore. My question to the health department here is, when a patient comes with a heart attack, acute MI, and the policy here is that your insurance does not cover for stent placement when they come during the golden hour. However, after 2 days, when the same patient goes through the angiogram and gets the stent, then your insurance is covered. And that is so unscientific and illogical. Because you are trying to save the muscle, but you are letting it to the nature to decide whoever survives, and then you are going to put a stent when it probably is not required. That is one. I have a litany of questions for healthcare, medical education, hospital infrastructure, the social justice, and so on and so forth. I am more than happy to discuss for hours and hours together with you. But then, at the same line, let me also highlight when one of the very prominent person died of a heart attack, one of the cardiac expert comes and then gives an illogical advice to the society and creates even more confusion. So without naming anyone, I think there is a drastic necessary in the system required for checks and balances. When you have strict guidelines available, if you cannot interpret the guidelines properly, then how are you going to deliver a proper health care to the patients? Yes, we are all talking here, we are all comfortable people who have accessibility to the hospitals, the best hospitals in the country or in the city. But there are 80 to 90% of the population which I try to interact, they are not even getting, forget the preventive or primary health care. They are all coming in their final stages. And the last thing for the department to think about is there is a huge role for artificial intelligence and machine learning where you need to challenge the current doctors. You also have to improve the healthcare delivery and hopefully you will create a social justice in the healthcare delivery in the system. Not the least, need should be abolished in the state. A best doctor is someone who is compassionate and empathetic. Your medical degree does not give appropriate care to the patient. You don't even have 5 minutes to talk to the patient, right? All the doctors, I'm talking to all the doctors here, we don't have 5 minutes to talk to the patient. How are we even going to deliver appropriate care? A medical professional, a student, should not be just a meritocrat. Your degree, your marks has been built within the four walls. You just don't know how to speak to the society and the people. There is a serious requirement in the entire country, not just the National Medical Council, entire country, to think towards the population, towards the society. What is that India is made of? What is that India requires? How is that we can change an appropriate healthcare facility to everyone? And good luck to everyone.
Thank you, Doc. Doctor, Mr. Saif will meet you post this program, and you need to jot down your name and thing, okay? Thanks a ton. We are short of time. We have Mr. Harshvardhan, the IRS officer for the Commissioner for GST with us, would like to say a few words. Yeah.
So greetings to you all on the Doctors' Day today. You know, doctors is the epitome of compassion. And like, you are the real angels, goes without saying. I don't want to repeat these things. And we all know what doctors are and what you did during the most challenging times which we have seen in our lifetimes. Just 3 years ago, when we faced the most, like the crisis which was never seen, the crisis of COVID crisis I'm talking about. So, today we actually celebrate you, your work, your service, your noble service to humanity as it is. And one thing that importantly stands out is, it is only the profession of doctors which basically brings home the eternal truth of the oneness of humanity. There are so many professions and we are doing, like, I do text work, somebody does that. But it is only the doctors who actually realize, like when the patient is on the table, like, and he needs a blood, goes without saying that there may be the closest relatives of the same religion or for the same denomination, but if the blood group doesn't match, it's of no use. It's only the blood group which matches the patient that's going to help him. And that blood comes from the blood bank. Don't know who has donated it. I think it is only the noble profession of medicine which brings about this universal truth. This universal truth of, and where does it go behind it? And when I said that the doctors are the epitome of compassion, dear friends, compassion in fact is the beginning of civilization. When the earlier man lives in the cave, primitive man, like what brought about civilization? The love and care and compassion for his fellow being. That is where civilization comes about. Dalai Lama today, in recent times, he said, compassion is the radicalism of times. We need compassion. Dr. Girish talks about doctors need not only be professionals. What he basically also meant is they need to be all humane. Doctors may not be having 5 minutes to talk to the patients, but even in the 5 minutes they try to do the best. But they need to have a humane approach. Coming today, a lot of initiatives have been taken by the government in the health sector, and checking the figures, there has been an increase in the union budget allocation by about 23% healthcare vis-a-vis last year. So there is a improvement in the government focus on healthcare. Of course, healthcare is a priority. Several schemes the government are doing. And of course, we have a long way to go. So every year there is an incremental increase. There is a movement forward, upward. And it's important that when we look ahead, it's important to every time have a day like this. And I would like to really congratulate Firoz Saab here for having this event here. I don't know how many places we celebrate Doctors' Day. And when we know that they are the most important people on board, most important. Just about 2 weeks back, we had a function in Bangalore, we call it the Humanity Awards, wherein we celebrated and facilitated doctors across Karnataka. We did it. We couldn't cover everybody, but we just had one organization was doing it as part of it. 50 doctors who had worked during COVID times. That's what was picked up. You all are champions. You all are heroes. You work for humanity. I really salute you. And in the end, I would like to again quote His Holiness Dalai Lama, who said, we don't need more successful people. We don't need more successful people. What we need is more healers, more restorers, more peacemakers. Thank you very much. Once again, I congratulate you for the success of the doctor. Thank you very much.
Thank you, sir, for your lovely inspirational speech for the doctors. While we end this program with a word of thanks, we would like to, if you have any suggestion to be given today, if you can just take this number down and just WhatsApp or voice or a message, we will write those and it will be handed over to the minister in person. You can take this number now, 9902577243. I'll repeat it for you, 9902577243. Please send a voice note, type a message, and believe me, this will go to the desk.
Whose name?
Thank you.
Name, sir?
Mr. Saif, S-A-I-F. So, Mr. Feroz Bhai will, from the word of thanks, thank you.
Friends, thank you so much. Personally grateful and obligated to every single person who's come here, more so the doctors. And I'm sure that all doctors may not be heart specialists, but they have a heart. Okay? Please, thank you so much. Extremely grateful to you. May I now request Dr. Mateen to conclude the session. And again, really, really grateful that you all come. I'm sure there will be some good outcome of this, which, believe me, this outcome is divine. And we do not know who's going to be held for that. Thank you once again.
Thanks, Feroz. We've all heard of a Janta Darshan. This is like a doctor darshan. Actually, doctors have a great role in nation building. And the nation is not about politicians, the nation is about us. And we need to recover that position of the common citizenry to speak to the powers so to be, so that we can create vibrancy in this society and in this nation. Excellent, excellent suggestions from Girish and from Dr. Sabina and Dr. and Dr. Umar. I mean, we need to put this across. They don't understand these kind of things. So we need to put across, and a lot of people stay disconnected, and this is a fantastic program, and first, thank you very much, and we should do more of these programs. Harshvardhan brought a very important thing about cross-matching and blood group matching. I'll just give you one little experience that we had. We do a lot of renal transplant, kidney patients. We do about 4,000 dialysis sessions per month. And one of the things that happened is one Muslim Maulana, a religiously educated man, needed a kidney transplant. So his wife finally decided to give a kidney. And then he went to actually global in that Uttarali mein hai na, Kengeri mein. He went there for a renal transplant, but unfortunately it didn't match. At the same time, there was a Brahmin pujari of a temple whose kidney was also not matching. And you know what? They swapped the kidney. The Muslim woman's kidney went to the Brahmin priest, and the Brahmin priest's wife's kidney went to the Muslim Maulana. Who's the number? I mean, we are one. I mean, it's that humanity that needs to be celebrated, and nobody understands it better than doctors do. That deep inside when we operate, it's all the same kidney, same liver, same bones. And this part, our nation, needs that kind of understanding of people deep down under the skin, above the skin also, we are all the same. And that message of humanity should be part of what doctors are doing. And therefore, thank you very much. Thanks, Nasir Sahab, for coming here, and thanks to Gundurao Sahab in absentia, and Qazi Sahab, and Harshvardhan Sahab, and all the great doctors here today. Let's enjoy a great lunch. Thank you very much.